Should see it in a second.
Okay.
All right, we are live. We are live, finally. Well, good evening, good evening, good evening. While we're trying to get settled here, for those of you who have seen, we have gone live. I want you to go ahead and to like this video, share it with your followers and your friends as we begin our conversation about COVID-19. I want to apologize. We are about a half hour behind schedule. We had a few issues trying to get the live feed going, but we are here now. So I want to welcome all of you who are logging in right now. So I'm gonna give you time to kind of log in, chime in, like this video, share with your friends and followers, do a watch party, and let's go ahead and kind of create the atmosphere conversation as we join in on a discussion tonight about COVID-19. We have a very, very special guest on tonight. I'm looking forward to the conversation, the exchange. And so I'm going to give folks time to chime in. Again, like it, share it, plug in, and we look forward to having you as a part of our conversation on tonight about COVID-19, also known as coronavirus. And so I'm looking forward to a great time on tonight. So yeah, go ahead, like it, share it, plug in, and we'll get started in about 1 minute. So I'm going ahead and give you time to kind of like it, share it. Again, I am Pastor D, Damian Madison. I'm the lead pastor of the Life CFC. Of course, you all have seen me before on social media. And so on tonight, I want to embark on a discussion that I think is very necessary. It's pivotal, it's prime in terms of where we are in our culture and in our world, in the nation, really, especially for us who are living here in America. And of course, but globally, it's a conversation that needs to be had and that we're facing every single day. So again, I want you to like this video, share it, invite your friends, your followers, do a watch party, and let's go ahead and create an atmosphere of conversation that will intersect our intellect and our inspiration on tonight. So yes. So again, it's 7:34. We're already behind schedule, so let's go ahead and kind of dive into for tonight. Again, I'm Damian Madison, the pastor of Life CFC right here in the DFW. We're actually in Plano, Texas. And so, again, we're here. And tonight, we have a very special guest, somebody who is, again, a graduate of the most phenomenal HBCU on the planet. That is the Talladega College in Talladega, Alabama. And so not only that, he's also a member of the greatest fraternity on the planet, the one and the only Alpha Phi Alpha Fraternity Incorporated. And he's also, more importantly, a brother of the Alpha Beta chapter in the state of Alabama. So hey, I got to go hard on that. A Phi A in the house tonight. So hey, look, man, brother, thank you so much for joining in on tonight and making time for us on your schedule. And now, let me share with you a bit about who this brother is, and it kind of gives some credence to our conversation. Dr. Alvin Smith, again, Dr. Alvin Smith is a trained medical microbiologist with a focus on virus pathogenesis and immunology, and former technical director and lead scientist with the Army's Medical Countermeasure Acquisition Program. He is a biodefense subject matter expert, having spent time as a researcher in high containment biology labs, where he directly coordinated and designed non-clinical testing efforts to support the licensure of an HIV and Ebola virus vaccine with Merck Research Labs, NIH's Vaccine Research Center, and Emerging Viral Pathogen Section. His scientific contributions have been leveraged by numerous government agencies across Congress, Department of Defense, Department of Homeland Security, Department of Health and Human Services, and the intelligence community. And he's a native of Miami, Florida. He holds a doctorate in medical microbiology from Howard University, again, HBCU, and a bachelor's degree in biology from the Talladega College. Again, so with all the words being shared, in short, he's smart. So we're gonna say it that way. He's smart. And so I think he is the perfect individual to begin this conversation as we engage in a discussion about COVID-19. So Alvin, hey brother, man, say hello. How you doing, man?
Damien, brother, thank you so much for inviting me on to have this conversation. I appreciate the introduction and everything. I think, again, this is a very timely discussion in the midst of so much going on, certainly with COVID-19, but also as we're hearing just additional news and reports on the impact to our community, right? And the impact to the Black community, to the Black diaspora, all of that. Again, very timely conversations. I know a lot of concern is out there, lots of fear. And I know that we're dealing with this pandemic in our own different types of ways. But we all have a role to play in this, right? So we all have a role, whether it's again, social distancing, or even if it's just down to washing our hands, all the way up to those folks that are on the front lines every single day, doctors and nurses and police officers and firefighters that are there, and also grocery workers, right? And Uber drivers and all of these folks that are essential and that are still there on the front lines of this, that can't necessarily social distance in the same way that a lot of us can right now. So hats off to all of those folks. They're heroes and things of that nature. So I appreciate you taking time to do this. I enjoy having these conversations as much as I can. So yeah, let's get down to it. Let's have some good conversation here.
All right, man. Thank you so much again. I appreciate it. As an introduction, I know many of you may be wondering, why as a pastor having this conversation about COVID-19? And one of the things that really drove my heart and my head to having this conversation was the fact that not only was I watching what was happening across the nation, of course, watching the news and having to respond to it, even within my church, to make a decision on how we're going to respond to it early on before we even got to the social distancing. And so that was one phase of it, having to, again, to react, and not necessarily react, but respond, to what, to the information that was coming out, that was unfolding. That was already one level of it for me. What made it even more serious and more personal for me was it actually came to my front door. And so, we as a country have lived through H1N1, Ebola virus. We've watched the news and kind of watched pandemics and health crises from afar. But things become different. It kind of, as folks say, it hits different when it's at your front door, right? And so the sad reality is my pops, my dad, stepfather, was diagnosed with coronavirus, and unfortunately, tragically, he passed on yesterday morning. And so I, in a very real way, I have seen what this virus can do. And to make matters worse, my pops, he fit that demographic of African American. He had 3 of the 5 highlighted underlying conditions that have been noted, and the impact on his physicality was devastating. And so to watch that live and in color. For me, it made it. There was no way I could not have this conversation because I think it's really. I think it's critically important that people understand what's real, what's factual, understand that the impact and the implications of contracting this virus, but also kind of walking through and debunking some of the myths, the miseducation, some of the rhetoric, even, and just even walking through this in terms of a faith response too, and how we navigate this. Because I never would have imagined that my family would have been hit by this pandemic.
Yeah.
And I don't think anybody does, right? And so. And so I think that this conversation, I think, so I want folks who see this to know that I'm not doing this just to try to get some views. I'm not doing this to try to, get attention. I really want people to understand and know what this really is, because it got real for me real fast. And so yeah, so let's go ahead and get into it. So Dr. Smith, what exactly is the coronavirus?
Yeah, that's a great place to start. So the coronavirus, also called COVID-19, and that's a different. That's actually a nickname for describing the coronavirus disease, and so that's actually what COVID is. And COVID is that of 2019, and so for coronaviruses, it actually represents a family of viruses, about and actually subfamilies, but it's a family of viruses, about 60 or so that are in that family of viruses that are, again, very small, and they're usually found in bats and things of that nature. And over the last decade now, and actually a decade and a little bit leading back to 2004, 2003, with the original SARS outbreak, which was also a coronavirus. These are when kind of these viruses have really burst onto the scene there. And we've been, again, seeing coronaviruses that have been found elsewhere, but really only recently have we seen them kind of infiltrate in the way that we're seeing them now, starting with the original SARS coronavirus 1. And this is actually, from a scientific name, this is actually SARS coronavirus 2, but we've called it COVID or COVID-19 in order to make sure that we alleviate that confusion between the original SARS outbreak and this particular one here. But again, it represents a family of viruses that really causes, in some cases, again, these respiratory illnesses. There's another coronavirus that we've seen also called MERS as well. And this is Middle Eastern, again, SARS coronavirus. This is another, again, type of respiratory disease. So these families of viruses, or these coronaviruses that live in this family called Coronaviridae and other subfamilies as well, again, they're part of those that can have respiratory effects on the host that it actually infects. And so so those are coronaviruses, and really dispelling a little bit and giving some insight on what COVID-19 is as well.
Definitely, thank you for that. So so that kind of sheds light and provides some understanding and even clarity to, because of course, across social media, I've seen people post photos of a Lysol can, with coronavirus on the back of it. And people kind of arguing that it's been here for a while now. So why are we just so kind of unpack that, and kind of help people understand that break down what it means to have a family of coronaviruses versus what makes COVID-19 stand out from what has been thus far.
Yeah, so that's a great point. I've seen those posts too, where folks are saying, "Oh, it's on the back of the Lysol can too." And so Yes, back in 2002 and 2003, when we had the original SARS coronavirus, again, there was a push to also changing labeling as well to, again, show that the disinfectant, in this case Lysol, was effective against, again, SARS coronavirus 1. And so when you see that on that, that's actually talking about that coronavirus not in line with, again, this novel coronavirus that we're dealing with now. So that's where the disconnect is. And this is a novel species and a novel strain, if you will, of, again, the family of these coronaviruses. So again, like I said, there are over 60, and we find majority of these, like I mentioned, in bats, and we really rarely kind of interact with them on the level that we are now. So in the first SARS outbreak, that particular outbreak was obviously not as extensive. It still infected a great number of folks. There were some folks that did succumb. The majority of what was going on was localized, though, to China at that time. And there were some sporadic cases that popped up in other locations. This particular outbreak is a lot more aggressive than the original virus that we were working with. And so we've seen patients, and you know, I'm so very sorry to hear about your stepfather, and these are stories that are shared absolutely among the world that are seeing the very quick progression of this virus within a matter of weeks, right? And so we did not see that with the last SARS outbreak as well. So this is, again, a different strain. That's why it's novel in that way. It does share some genetic properties, but overall, it is a different virus and much more aggressive than what we've seen before. And so as we learn more about this, and this is the other thing I think that within social media and folks as well, this is an iterative process, right? We're learning a little bit of as we go through and get more data, we're able to adjust kind of how we think through and the recommendations that the CDC is offering and things of that nature, because we're learning more based on the data that we get. And so while we don't want to base everything on the last experience, there are some lessons learned that we are able to apply scientifically. But again, this is a novel virus. And so we're really having to learn a lot faster and really deal with things a little bit differently here. So.
Definitely, yeah, I think that's true, because again, and you're right, the aggressiveness of this virus,
Yeah.
I mean, it's awful. I mean, really, because, you know, especially if you have underlying conditions, just to have noticed and watched it, you know, the digression of my pops. I mean, and it was radical. So let's talk about this for a moment. Let's kind of talk through a bit about how is the virus actually spread. You know, what are the facts about how it spread?
Yeah, you know, that's great. So the facts is that the virus is spread person to person. And what we're seeing is that it's spread through what we call respiratory droplet transmission, right? There's lots of ways for different pathogens to be spread. And this particular one is spread through respiratory droplets. And so as I'm talking right now, I could be, you know, spitting as I talk, right? Or if I am coughing or sneezing, again, my deep inside my lungs, as I'm bringing up, again, sputum and spit and things of that nature, there are tiny particles that are called aerosols as well. And so you can aerosolize things within your lungs and then emit or transmit those out of your mouth, again, either as you're talking or with violent spasms through sneezing as well. So this respiratory droplet, as you're coughing or as you're talking, again, we're all learning more about this. But one thing that we did know very early on was that it is respiratory droplet. It's not it's not airborne. And so that's also a common misconception that I have to also talk with folks as well. It's not airborne, but it is aerosols, and these aerosols can travel a distance, and not great distances like miles, but certainly in the order of magnitude of feet. And so if you're 6 feet or 8 feet away, that lessens the likelihood of these aerosols kind of traveling and actually meeting your mucous membranes. But as you're talking, and as these tiny droplets of spit or aerosols, they carry large amounts of viruses inside. And so in that, as these viruses land, maybe in your mouth or maybe in your eye or what have you, that's how you become exposed. You can also become exposed if you touch certain surfaces. For example, as I'm talking right now, I could very well be spitting and that spit lands on a surface. And we've known now, and even through data that we've seen, that the virus can survive on surfaces for, depending on the type of surfaces, for hours, including up to days, depending on, again, environmental conditions or what have you. And so this also becomes a vector or a means by way one can go and then touch that particular surface and then introduce that into their eyes and into their mouths. And again, this is why we repeatedly tell folks, again, wash your hands consistently with warm water and soap to make sure that you lessen the chance for, if you are touching these surfaces and things that, again, we touch our faces over 1,000 times a day without even realizing. And I think I touched my face a couple of times even just now, right? And so with that, if our hands may be contaminated with the virus, then me introducing that by touching my face and touching my eyes and things, that's another way of how the virus can impact us, or how we can be exposed to the virus as well. So again, that's why social distancing is so very important. One, it lessens the chance of those aerosols to actually reach you, right? And Damien, you've seen it as well, right? If you spray that Lysol can, you see those very fine bits of the disinfectant come flying out, right?
Right.
Yeah, those are aerosols, right? When they're very fine mist, those are aerosols. But what happens with those aerosols as they travel, as you've seen it, they start to fall down to the ground, right? So when that happens, that means that they're also contaminating the surface. And what we've seen, even though now we've seen data coming out of China that they're finding lots of virus even on the bottom of shoes, right? Because again, as these aerosols travel, they have to fall to the ground. And so they're falling and folks are walking. And again, they may bring that back into their homes or what have you as well. So that's another way of how this virus is very formidable by staying around on surfaces. And we've seen this with other viruses as well. So let me not get too far ahead and say that this is novel in that way. We've seen the same thing with regard to Ebola. There's work that's done there, and other viruses as well. So this phenomenon of being able to survive on surfaces and being spread is absolutely something that we see with regard to how viruses are transmitted.
Wow. If you don't mind, I definitely want you to kind of provide again more of a breakdown and kind of unpack the difference between it being airborne and being aerosol a bit more, only because I want to make sure that people who watch this are clear and know the difference between it being airborne and being an aerosol effect. Because again, the two are very different. But again, because people are already hypersensitive. I mean, people
Sure.
are already, they're on 10. And so, and so I want to make sure that we understand and that we're clear on what that difference is and the safe way to respond to that.
Yeah. So when I say aerosol, again, I'm talking about very small, fine droplets, mist even, that you may be able to see, you may not be able to see as well, because again, these are very fine particles, but they are associated, but the virus is associated with these very small droplets, and they are droplets of sputum or spit or what have you. And so even though that we can't see them, they're still in that very fine mist. Now, as we all know, when you spray the aerosol and someone walks through that mist, right? That mist, if you spray a Lysol, and I have a Lysol can here, right? So if you spray that mist and someone walks through it, then you can actually see that mist kind of floating in the air a little bit as well. Again, that's one way that these aerosols can travel a little bit further than, say, 6 feet, 8 feet, or what have you, but they're still moving on the current of that particular wind of that person walking by. When I say, and the virus is still associated with those very small droplets, that's why it's still respiratory droplet. Now, when I say airborne, I'm talking about a pathogen that's able to travel, say, just as I've described with walking through in the waft of air, but they're able to travel great distances, like, again, miles, and in that way, able to maintain the virulence. So they're able to survive the environment. So being outside, exposure to UV sunlight, exposure to the different conditions, and then being able to carry on perhaps maybe dust particles and carry long distances. So the types of viruses there that I'm talking about are like viruses like the measles, right? That's actually an airborne virus. And you can see that depending on what we call, and folks may have heard this term, called the R naught, right? And the R naught defines, it's actually a mathematical term that defines the number of people that can be infected after one person is infected. So if I'm infected, how many people will be infected by me interacting with them? So right now, the R naught for the current COVID-19 is believed to be somewhere around where we see flu, which is about 2 to 3. And right now, we're still doing research. We're getting additional data right now feeding into that says that that number may be a little bit higher than 2 or 3. It may be in the order of magnitude of 4 or 5. But again, that's still math that's being worked out. When you compare that to a true aerosol virus, or excuse me, airborne virus like measles, the R naught for that is about 15. It can be anywhere from 13 to 15. And so that's another way, again, that virus is able to travel and infect a lot of people. That's why we're seeing so much measles outbreak over the past year as well. This has been a resurgence in that. So those are kind of the two differences there. You have one aerosol, it must be associated with a particle droplet in order to travel. And then airborne, it does not need to be associated with that respiratory droplet. It can be associated with environmental conditions like dust and things of that nature, and still get the very long distance, not just feet, but orders of magnitude of tens and hundreds and thousands of feet as it travels a mile or so. So that's kind of the difference. And as we think about other viruses that live in that airborne type description versus those that don't. So does that help and understand?
No, great. I mean, thank you. I mean, I just want to make sure that people understand
Absolutely.
the difference between it being airborne and having the aerosol effect. I mean, just kind of know to hamper down some of the hypersensitivity. Now, so with that in mind, let me ask you this. So because it is an aerosol effect, what is the benefit or lack thereof of wearing a facial mask?
Yeah. And I knew I was actually about to jump on that right before, so I'm glad you touched on that. So yeah, so the benefit there, and this is why also some of the guidance for the CDC is kind of changing and changed in that over the last couple of weeks. And one is that while we knew that, again, that asymptomatic folks have the potential to, again, spread via these aerosol droplets. Again, we figured, and I think this is at the same time, is that the testing would also keep up to really understand who's sick and who's not sick. And because that we're still behind the curve on that, of really understanding who's sick, and let's isolate versus not sick, we have a mixing of populations of asymptomatic folks, symptomatic folks, and those that aren't sick and aren't infected at all, right? So because of that, and because the ability to transmit via these aerosol droplets, these face masks are in place because, again, if you are asymptomatic and if you are even symptomatic, if you're symptomatic, you should wear a mask and stay home. But certainly if you are asymptomatic, then you may not know and you may be interacting with folks shedding those aerosols. So this mask is really to help, again, stop and mitigate the risk of you shedding via these aerosols. Now, because it's not airborne, again, these masks aren't going to stop you from inhaling, right? I think that's the common misconception, right? That folks are wearing the mask to stop from necessarily inhaling this and inhaling that. Again, these aerosol particles are very fine as well. And then, so at the same time, it's not really stopping from inhaling, but what it is doing, it is helping with the benefit of you shedding virus and putting those aerosols into the atmosphere for those that may or may not be wearing masks. And I think that's the other thing that folks need to think about, where it is a benefit, where again, we are a global community in this. And so while the benefit is not directly on you, it's actually a benefit on society and those in your family and those whom you shop with and the workers and the grocery stores. All of those things, wearing the mask is a benefit because you very well may be asymptomatic. So that's why, as we learn more and we realize that we're really behind the curve on testing, that again, wearing these masks are helping to mitigate that in the event that you are positive and sick and positive for coronavirus, and then but don't have those symptoms that you're like, gosh, I need to stay home right now. So the masks are really helpful, but we want folks to also understand that, again, having just any face covering, cloth, really works to even cut down on the velocity and the benefit for those aerosols to travel. So, for example, if you do have a cloth face shield on, and you are, let's say you are symptomatic and you are coughing, now, right where your mouth is, again, viruses are getting caught in this area here. And so as you cough, and particularly, there could be some small aerosols that are released, but they aren't traveling great distances, maybe because they have to go through this torturous path of going through your mask, then the aerosol particles don't travel as far. And so with that, we're able to see that, again, the masks are helping kind of stop the long transmission of these aerosols. But again, this part right here around your mouth is still and could be very much latent with a lot of virus. So when folks are removing their mask, they need to be very careful as well, again, if they're asymptomatic or if they're symptomatic as well, because you don't want to touch the front of your mask and you want to remove it in a way that limits, again, the ability to you contaminate something else. And so these are things that one can do, but definitely wearing the mask is important to stop and mitigate the potential for, again, exposing others if you are asymptomatic.
Thank you for sharing that. Thank you so much, because that they help shed some light and bring clarity. And just to reiterate, so the benefit to wearing a mask or any cloth face covering at all is more so if you are a person who is asymptomatic or even maybe even symptomatic, you're actually being compassionate and caring about other people because you are protecting others from yourself. More or less, right? And
yes, absolutely.
Thank you. So I think that's kind of important for us to know that but if we extrapolate that, in essence, it's a mutual benefit. If we are aware of it, then we're expanding the benefit of it because we're not hurting each other. So
Exactly.
thank you.
Yeah, it's all these little things, right? It's all these little things that we do, from wearing the mask, from washing our hands, for, again, if we're again sick, isolating ourselves, doing the social distancing with 6 feet and 8 feet. It's a cumulative effect of doing all of these things. So it's not just one thing. So if folks say, yeah, well, I'm social distancing, but I'm not washing my hands or I'm not doing these other things, again, that doesn't necessarily help because it takes everything, it takes everyone to be a part of that solution.
Thank you so much. As a side note, parenthetically, it's really interesting that it took a pandemic for us to get used to washing our hands. I'm sorry. I mean, I had, I mean, but just something as basic as washing our hands. It's like this is a novel concept. Wash your hands. I mean, I don't know, but anyway.
You'd be surprised, and you'd be surprised, honestly, that and this is really from a public health standpoint. Again, the number of just whether they're food related illnesses, so foodborne illnesses, things like that. Again, lots of those are transmitted, and again via us and via our hands. So the ability to wash our hands and things, we learned this as kids, and over the years, I think it's one of those where maybe we think, oh, we're clean enough, right? Oh, I can't see anything on my hands, so they're clean enough, or what have you. We're learning and relearning really the impact that is, and that continually washing our hands, whether we're again in the food industry or whatever we do in life. Again, it's a very, very effective way to make sure that we do not expose ourselves unwittingly to things in the environment. So absolutely, yeah.
So there's a word that you keep dropping, and I want us to kind of dance on that word a bit. And that word is asymptomatic. Now we know we've heard that word in the news. We've heard it. It's been talked around in this conversation. We probably have seen it on social media. So let's. I want to make sure that people really understand, what does it mean to be asymptomatic?
Yeah. So we define asymptomatic, and in the science world, if you put a in front of anything, it means not that. So whether it's asymptomatic or avirulent or what have you, all of these things mean, again, not virulent or not symptomatic. And so and this is not, again, the first time that we've seen asymptomatic individuals that are infected. And so, for example, let's take a step back and look at other viruses and other things as well. If we take HIV as well, right? Again, at some point, we know that with that particular virus, there is a latency that can occur. And in that latency, signs and symptoms are not being projected. And so in that, the person is still sick, but again, they're not projecting, or they're not seeing, again, or feeling these symptoms or presenting with signs. So as you describe, and as one describes asymptomatic, it really is being infected, so being exposed, being also infected, because here's the other thing, Damien, just because you're exposed, exposure does not equal infection. And infection does not necessarily equal, again, a negative outcome or a negative disease. And we've seen that even with this, where, again, just because you have folks that are infected, that does not mean that they're automatically going to have a negative outcome. There are folks that do well. Right. So in that, it's one of those that really describes those folks that are sick, but due to it could be their immune system, and this is also something that we're thinking, is that what we see with other viruses as well, our immune systems, again, very intricate and complex system here, right? And it functions on a variety of levels, from what we call the innate immune system to the adaptive immune system, and all of those play together to keep us healthy. And so in that way, where folks are sick or are infected, their immune system may very well be doing a great job at keeping the virus at bay. And so from really masking some of those symptoms that they may be feeling, such as, again, I feel body aches, or I may have a headache, or I may feel chills, things of those nature. And it may also mask the signs as well, which could be those things that we see outwardly, like coughing and sneezing and things. So again, everybody's different. Everybody's immune system is different. So we're learning more about how this virus interplays with everyone's body and everyone's immune system. It's also very interesting with this virus is that since it is intracellular, so it basically goes inside the cell, and then as it replicates inside the cell, it doesn't burst open the cell, so you see a lot of viruses right away. This virus actually buds from the cell, so it kind of if you think about if you drop oil in water, right, and you see these little blebs of oil that are kind of around the pot or around that. Those are the types of little blebs or things as this virus is coming off. It's actually making these small little pockets, but these pockets are also wrapped with our cells because the virus is actually coming off and being wrapped in our cells. Now, because it's doing that, it actually has the ability, like a lot of envelope viruses, the ability to kind of mask itself as, hey, since I have the surface of this cell that I just came from, maybe you can't see me as quickly, right? And so that also limits the body to respond and produce an immune response. So there's lots of different things at play here. But again, it boils down to the fact that these asymptomatic people are absolutely infected, but they may not be showing these signs and symptoms because the immune system may be doing its part here. And so as the virus starts to overtake the immune system, then you start to see some of these signs and symptoms as well. And so that then moves from an asymptomatic phase to then a symptomatic phase where you're starting to see these things. And so again, like I said, we've seen this with HIV, we've seen this with some STDs as well, with herpes virus and things of that nature, where in some cases you have females that may be symptomatic, and you may have some males that are asymptomatic in that. And all of these things, again, it just depends on the types of viruses that we're talking about. So again, boil it down, asymptomatic, you're sick, but you're not showing any signs or symptoms yet.
Wow. And so more or less, you're also saying that this virus, and like some others, has the ability to hide in plain sight.
Yes. Yes, absolutely. And you still, and the interesting point in that, if you're asymptomatic, you still have the ability to infect others. And so that's the other thing as well. Just because you don't feel sick, and just because maybe your immune system may be working to kind of keep things in balance, you still have the ability to infect others. And you may then still test positive for an antiviral test to see if the virus exists in your system. That's why, again, asymptomatic folks, we're telling people that even if you don't have it, you may not be feeling, but you could still test positive and still feel, fine. Like, how many times have you heard, like, oh, well, I feel fine, I feel good, but you're absolutely still infected and have the possibility to infect others.
Mm-hmm. So with that in mind, so let's go here. So with all the hype, all the information is out there, who is the most susceptible to this virus?
Yeah, so right now, and is that there is no difference to being infected. So people right now, people are susceptible. And there's no difference right now of susceptibility to being infected. So anybody can be infected. And I remember earlier there were urban legends saying that, because we weren't seeing the data and seeing the news on exactly, again, who was being infected and what were the rates early on, there were some thoughts that, Black folk, aren't getting coronavirus, and, it's the melanin and what have you, all of this, which is not true. Again, a coronavirus is real. And so there is no difference on how it infects. But what we are seeing is that there is a difference in how people are dealing with that particular infection. And so because in our community, there are those underlying conditions such as cardiovascular disease, hypertension. I have hypertension, right? Genetically. And you have other autoimmune diseases, sickle cell, lupus, all of these things which disproportionately affect our community. We are seeing that, again, while anybody can be infected, we are dealing the worst right now. And even new data is coming out, even looking at Latino as well, in seeing that they're also, again, not doing great as well with these infections. And so now that the data is coming out, and I hats off to New York for really starting to classify the data in that way, which is not typically done. And usually data is kind of broken down by age and things of that nature, while they are collecting, again, demographic data regarding race. A lot of that information is not shared broadly. And so that's why, hats off to New York for doing that and showing that, no, actually, the majority of patients that we're dealing with that are dying are actually African American. And again, we know that these underlying illnesses disproportionately affect our community. And I'm certainly happy to get into that conversation as well. Certainly being a part of HBCUs my entire life, we certainly have been trying to look at how these diseases are affecting and affecting our community, and putting research in place. Certainly at Howard University, have been dealing a lot with that. And a lot of my colleagues and classmates at the time were looking at things like breast cancer as well, because breast cancer is another one that disproportionately affects our Black women. And so with that, we also see that these viruses and what have you then negatively affect those that are immunocompromised, such as those dealing with these types of cancers, whether it's breast cancer, prostate cancer, you name it. So yeah, it really goes back to, again, anyone can be infected, but again, it comes down to who's dealing with the progression of the disease in the most aggressive and the most severe way. And unfortunately, as we've seen this with a lot of other viruses, it usually falls on, again, the communities that our community that have those underlying issues, but also the poor as well. And so those without access to proper health care, without access to again these areas where they may be living on top of each other, like in New York and things of that nature. Unfortunately, all of those situations do not bode well for being able to do and be effective in mitigating infections, unfortunately. So that's what we're seeing now. So yeah, I think there's a lot of conversations that folks are having right now, and awakening and saying, yeah, in the midst of this, with social media being a powerful tool, as to, yes, we need to get the word out there and start being proactive. And I absolutely champion that. I agree with that. And I have some thoughts on that as well, that how we can play a part in that success as well. So again, anyone can be infected, but we need to do our part, because we're seeing that, unfortunately, us Black folk are really doing poorly with these outcomes.
I was showing on our podcast earlier that what this coronavirus has actually done is unearthed and exposed issues that were already there. We already knew that Black folks were being impacted disproportionately by various health issues. I mean, we knew that already. We already knew that, even within the healthcare system, that there was a clear dissonance between quality care and what's been been provided to many of our Black and brown brothers and sisters. And so these are things that we already knew, right? And so it's exposing the what I said earlier, the pee in the carpet, as it were. The stain was already there. It just began to resurface again. And so, but I love how you say that, though, because the fact that anybody is susceptible, right? So thanks for that clarity. So I also then, listen to what you're sharing is the question isn't really being susceptible, it's the level of impact based on your demographic and your health conditions, right?
Yeah.
And so, and I saw that, again, just moment of transparency. I saw that with my dad, my pops. And he was diabetic, had respiratory issues, high blood pressure, right? And by the time he got to the ER, he already had pneumonia in both lungs already. And so so again, the disparities, the impact, what we're wrestling with in our communities, just with regard to health in general, I think is a cause worthy of championing, even outside of this virus, because we are wrestling with, again, in a very disproportionate way, high blood pressure, diabetes. I mean, the list goes on, right?
Yeah.
And so I think that there's a call, it needs to be a clarion call to respond to these things now more so than ever before.
Absolutely. And Damien, let me also say this as well, because and unfortunately, we have short memories, right? And we're developing shorter memories even with social media. But I think at the same point, we saw this same phenomenon even with HIV. But I think because and I'm so happy we're having this even in church settings as well. With HIV, we saw that again mostly in a different population. It was in the LGBTQ what have you population, and so because of that, there was a lot of, okay, well, it's not in my backyard, so we don't need to talk about these things. But we saw again the same trend that was happening back then that's happening now, and we didn't have those conversations. And so now that we see this, where no, this is not just regulated to a population that maybe folks don't want to talk about in the Black community, but this is actually something that's impacting everybody. So now, you know what, it forces us to have this conversation when we should have been having this conversation about health disparities, about all of this decades ago. I'm happy we're having it now. But at the same point, we need to also, again, don't let the fire die. Don't let these conversations die, and continue to have these in our churches, in our homes, and everything else. Have them in our laboratories. Sit down and have them with your doctor as well, as to, okay, I get that I have hypertension, or I get that at the same point I may have all these other underlying conditions, but what research, other than putting me on these pills and everything else, what real research is being done so that my longevity, not just for me, but my community can also be impacted? So I'm so happy that we're having this, and I hope we don't lose this train of thought for the next pandemic or the next virus that will undoubtedly affect our community.
And I'm so glad you said that, and I want to even, walk that a step farther. I don't want to wait until the next pandemic or the next, tragedy. Here's the thing, within the Black church especially, I think we really have to begin to have real conversations about what's impacting our communities, right? It's not a matter of praying stuff away. Again, I'm a man of faith. I believe in prayer. I believe in God's word. Yes, but I also know that God has given us the gift of scientists and doctors and researchers and medicine. And so I think we have to begin to translate how our faith begins to inform our wisdom, and we live that in a very effective way in life between Sundays, right? And so I think what we have to do is begin to have these discussions, and recognize that these are real issues we have to confront. High blood pressure is a real issue we have to confront. I don't want to have to do a funeral for somebody that could have avoided their demise. It's crazy. I grew up watching this stuff where, you got diabetes, you got high blood pressure, and you're going to sit there and drink a whole glass of sugar with some Kool-Aid on top of it. And then you're going to have, you got your hot sauce, your fried chicken, and then you're going to pray for the food. Lord, please remove what might hurt my body. Wait a minute. Now you are eating your death, but going to pray and ask God to take it away. God, like, hold on, no, you doing that to yourself. And so I think we have to really wrestle with these conversations and be real about this stuff. That look, your diet matters, your exercise matters, going to see a doctor, it matters. Yes, we pray, but the Bible tells us that God has not given us a spirit of fear, but what? A power, love, and a sound mind.
Absolutely.
We have to begin to think through these things and know that our intellect and our inspiration go together. And so,
Absolutely.
so I love that. So with that in mind, because I'll go on that, forever. But
I think you touch on a great point, which is that we have to take charge of our health. We have to take charge of our health care as well. And it's not a back seat to that, where allowing others, again, to dictate, kind of how we play in that space. I think we need to empower ourselves with knowledge, not conspiracy theories, not saying, this is based on 5G or SG or anything of that nature. It's taking charge by, again, empowering ourselves with information, and then going into situations where we're having those conversations with our physicians. I'll say this too, and again, I'm a big proponent and a big champion for vaccines as well. Again, I started off my career and did lots of work with HIV vaccines early on. And so one thing that we struggled with as well, and we still struggle with, I think, within clinical trial space today, is really getting our people involved in those clinical trials. And so one thing I think that we can really have a positive impact on what the outcome looks like for our community is really being a part of those. And I'll tell you why. For example, when we were doing studies back with HIV, and HIV, again, was broadly, again, it is a pandemic, it's spread around the world, and there are different strains or different what we call clades as well that live out in different regions of the world. So for example, the clade of virus that's really here in the US is different from the clades of viruses that are existing in Africa. And so as we start to do these vaccine studies, some of the studies are designed around what we call multi-clade, which bring all of these different clades from regions into thought as we start to design these vaccines. And we find that there are some vaccines that do better with certain clades. But again, when I was in that space, I had folks from Africa showing up to conferences saying, hey, we want to make sure we're heard at this conference so that our clade and the virus, the species, the strain that's affecting us is included in these vaccine studies. Because if it's not, then the product that comes out of this may not then adequately protect us as well as just protecting folks in Europe and America. So I say that as we started to do vaccine trials for coronavirus as well, if we decide to check out of that process, and I get it, right?
That's good.
The US, America, really has a poor history of working with the Black community with regard to medical studies from Tuskegee all the way to Henrietta Lacks. I get it. And so, however, we still can't allow the fear and the conspiracy theories to really dictate our checking out of that process. Because if we allow that to happen, then again, these underlying conditions that we're talking about now won't be brought into consideration as folks think through, let's look at the data from this vaccine study. And if they don't have our bodies in these studies, then there's no way that they can compare then how this particular vaccine is going to work or may not work in the context of these underlying diseases, such as, again, heart disease, all of these things, to include autoimmune diseases as well, lupus, and even sickle cell, which again, really disproportionately affects us. Right. So again, we have to think about this in a different way of, if we want to be included in the solution, we're going to have to engage and be proactive in that conversation and be proactive in these studies as well. But it's going to take that intellect, and it's going to take folks to really sit down and explain what's going on and really what this vaccine is, what it's not, and dispel those myths and conspiracy theories as well. So I'm happy to have those conversations. I'm so happy we're having this conversation now to start that conversation to get us engaged and take control of our healthcare.
No doubt, no doubt. And I look forward to having many more of these because again, the goal of our church, the mission of my ministry is to impact life between Sundays. And so I want to make sure that we have an intersection of our intellectuality and our biblical inspiration. The two have got to go together. So with that in mind, let me ask you this, because I want to make sure that we're clear for those who are watching. Why is social distancing so important? Why?
Yeah. Social distancing is so very important because if, again, we're not wearing our mask, or even if we have not properly washed our hands, maintaining that distance is the very minimum that we can do to really start to mitigate us being exposed to this virus. And
Right.
so a minimal distance of 6 feet, 6 to 8, depending as well, is the very least that we can do. Again, we may live in a situation where we have older people in our households, things of that nature, and whereby, again, we're very intimate in that family structure. If we're out and we're potentially exposed by being too close, by having someone kind of talk next to you and what have you, or you outside hanging out on the corner and y'all, dapping up or what have you, all of these things, again, you are potentially exposing yourself, that then you could bring that home and certainly impact other members of your family, and namely the most vulnerable, that could be the elderly or the immunocompromised or what have you. That's why social distancing is so very important. And so hats off to those folks that are doing it, are making that sacrifice. It is a big sacrifice, but at the end of the day, it's helping us so we don't have to make that ultimate sacrifice of again, death, or making those decisions of how to deal with loved ones that may ultimately be sick and be not doing so well as well. So all of these things really help us. It's the bare minimum, I believe, that we can do to really be effective. And we're seeing that it's working. The data has shown that, again, once that social distancing was in place, the number of cases dramatically decreased. And so that's why even as we're thinking through now reactivating or getting our communities back engaged, we have to do this smartly, because if we don't, then we can certainly, again, all that we've done by doing this could all be for naught, and we can see a resurgence of virus infections in communities where it was really low. And so all of these things are again, very important, but social distancing is number one, I think. And even in communities where we don't see a lot of infections right now, again, that's still very important because people aren't traveling as much. We were, before I had the opportunity to stay at home, and I look at it as that, giving me the opportunity to stay at home, was that I was doing whirlwind travels. I was all over the place for my other job. And so because of that, again, I was coming in contact in different things and what have you. Now that that's stopped, again, that's then changed my dynamic, but I think that's also changed everybody's dynamic. Now we need to be smart about how we re-engage back in long distance travel and things like that, because if we don't, we can inadvertently not necessarily just bring virus and see a resurgence in communities, in our own communities, but if we travel to different places, whether it's in the United States or outside the United States, we can then impact those areas as well. So we really need to be careful about how we re-engage. But certainly social distancing is absolutely imperative right now. And I think, and absolutely it's working.
Good. Thank you so much for that. So my last question.
Yeah.
So can you dispel for us some of the myths and urban legends about this virus?
Yeah. I'm on social media just like you, and at the same point, I see a lot of these as well. Obviously, the first one that I think we can put to bed is that Black folk are immune, right? That and that there's something about Black folk, what have you, that keep us immune. That's absolutely not true. We can all be infected by this. So I think that's one. The other one is that, and I talk about this on my YouTube channel as well, so I'll give you that information, is that, I've seen folks that have been sending me videos and things of people sniffing pots, right? And that if I sniff this pot, the steam from the pot, if there's virus in my nose or my mouth or what have you, then that steam is going to kill the virus, what have you. That's absolutely not true. I speak about this on my page.
Pause.
Yeah.
Rewind.
Okay.
Say it again real slow because that is a big one. I have seen that posted. I've had folks send it to me in text messages. I want you to reiterate that one more time, really slow, so the people can hear it and digest it. Go.
The steam pot does not prevent you from getting infected, nor does it clear the virus if you are infected. That does not work. Because there have been in that same post, and I've seen the video as well, where it's saying, oh, heat kills the virus. Heat kills the virus. And I speak about this as well, that yes, heat does kill the virus. But at the temperatures that we're talking about, we don't get that in this steam pot. Now, I'll give you an example. So where we see the virus start breaking down is that at about 60 degrees, about 56 to 60 degrees Celsius. And in scientific terms, we speak on Celsius. Water boils at 100 degrees Celsius, right? So that's what we're talking about when we say temperatures in that way. So 60 degrees, and then at 80 degrees Celsius, we see the virus actually dies. Now, let me then interpret that into Fahrenheit, where we live and we see a lot of our temperatures as well. So Fahrenheit, average room temperature is about 71 or 70 degrees Fahrenheit, right? Go look at your thermostat. That's kind of where it is. That equates to about 22 degrees Celsius. Now, when you are talking about where I started 60 degrees C, that's actually 140 degrees Fahrenheit. Okay, so that's 140 degrees Fahrenheit. So that means that in a situation where, again, you're saying heat's going to kill the virus at whatever temperature, maybe outside or inside with this, that has to go up to 140 degrees Fahrenheit. At that level, I said viruses are dying at 80 degrees Celsius. That equates to 180 degrees Fahrenheit. Now, again, as you're steaming water, absolutely, the water itself may be 100 degrees Celsius. That's true. But the steam that's coming out and what you're inhaling into your body is not at again, that high temperature of being 80 degrees Celsius or even being anywhere close to that. So what's happening is that, yeah, you're getting steam in your body or mouth, but that's ineffective at actually killing the virus. So you're not reaching the temperatures where we're seeing the virus actually dying. If that steam were that hot, and it were actually 80 degrees Celsius as it entered your nose to kill the virus, you would inadvertently burn yourself. You would burn your inner lining of your nostrils. If you were drinking tea, that's another one, right? Oh, let me drink tea in my mouth because the heat's going to kill the virus. If you were drinking water and tea that hot, then again, you would also burn the inside of your mouth as well and burn the esophageal lining as well. And so all of these things, again, it's true that heat kills the virus, but not at the temperatures that folks are claiming happens in these conspiracy theories. So inhaling water or inhaling steam or pot, that's not doing anything. It may help you feel better. There is data that's saying absolutely, you inhale steam, that helps to open up your lungs or what have you, and that's fine. And we've seen that with like dehumidifiers and things where folks are congested. Absolutely, steam can help to kind of loosen up mucus, things of that nature, but that does nothing, again, for the coronavirus. That's absolutely ineffective. So that's not going to help.
So in other words, unless you're Captain Marvel, get that hot, it does nothing.
Exactly. Unless you get it that hot, where literally you have the potential to burn yourself, then no, it's not at anywhere close to temperatures to break down any virus at all. And even as folks are saying, drinking and sipping hot water, that's not going into your lungs. That's the other thing. It's like, oh, if there's virus in my mouth, I can wash it down my throat into my tummy or what have you. And I saw some posts where it was like, oh yeah, my nephew that works at the CDC or something like that. And I'll tell you, there's a lot of people that work at the CDC, and from scientists to all the way in the swath of folks as well. So again, just because they work at the CDC or maybe doing this, again, we got to be really factual about the information that we're providing here. Because again, misinformation is just as dangerous, even more dangerous than actually not doing anything. So because it has the viral nature of to carry and spread, we must be very clear with all of these things and not perpetuate the stereotypes. So I thank you for doing that. But certainly drinking tea, going into your throat and going down into your stomach has nothing to do with your respiratory, with what goes into your lungs at all. Those are two different systems, right? They may be side by side, but they're two different systems. So that's also a common misconception as well. That certainly we need to address. So the steam one, I've heard of people saying, yeah, rapping or hitting people on the back, that helps as well to get the virus out. Again, that's not true. That hitting yourself on the back is not doing anything to expel any virus. If you're infected, the virus is associated with your cells that are, again, found in your body, in your lungs, things of that nature. That is not helping to expel any virus out. It may be helping to clear so you can cough. It may be helping to loosen mucus up, just like the steam may be helping in that regard, but it's not having any effect on the virus at all. Again, very small, and again, associated with your cells. These things are not having the effect that people are pushing on social media at all.
Great. One last conspiracy theory that I want us to discuss very briefly is the whole notion of 5G. I mean, if I see one more Stay Woke video about 5G, I promise you, I'm gonna bump my head against the wall. So let's talk about that. Now let's kind of unpack that for us.
So I've seen the same videos, and folks have been sharing information, videos, and stories, even from some folks in my family or what have you, been sharing the same thing. And so at the end of the day, there is no data to correlate 5G with any of this. I will say SARS, coronavirus, this virus is real. It is real. And from folks that are dealing with this intimately with their family members, absolutely. And like I said, even in your regard, Damien, firsthand, this virus is real. People are actually dying from respiratory illness, not radiation poisoning or anything else related to this 5G conspiracy. This is not what this is. This are folks actually dying, again, from respiratory. So there's no data to correlate. And I think because things, again, started in China, in Wuhan, China, and at the same point, there may have been some overlap with regard to, again, hitting the switch maybe on 5G in some regions. Again, 5G is not something that's broadly found in areas where even folks are getting sick, right? You're finding pockets of infections in countries, even in Africa, folks have been sick, in Nigeria, what have you, that again, aren't in this 5G world. So again, what do you say to that? And so at the end of the day, again, we have to arm ourselves with facts. And I'm a strong believer in data and science. So everything that I say, even in my YouTube channel, I back it up with science, with papers that I can present from reputable journals that again have data that we can arm ourselves with and look at and see and even ask questions about. And I ask people to do that as well. Look at those papers, because again, that's where it lies. If folks are talking about all of these conspiracy theories with no data and just conjecture, then again, I put no stock in that. And I always come back with facts and not fiction. And I really want to be absolutely honest and candid. I am not telling my family anything that I'm not sharing broadly with your congregants and with anyone else. Again, we have to dispel that because we really need to make sure that folks are having these conversations with their physicians.
Yeah.
And that they're seeking the help when they need it. Because if we're not asking these questions, or if we're not going to our physician, or if we're believing that all this is conspiracy theory, then unfortunately what happens is that we wind up not getting the access to the healthcare and access to again, vaccines when that happens and everything, because we could be so blinded by some of these conspiracy theories. So I absolutely do my best to dispel those. So thank you. But you know, there's no 5G that's associated with coronavirus, and I think slowly folks are seeing that and seeing other posts and seeing that basically when they peek behind the curtain and they see what's going on, the emperor has no clothes there, right? It's just not true. It's fiction. And we need to do, like I said, a better job in taking control and taking hold of our healthcare and being proactive.
Thank you, man. Thank you so much. So first, man, I want to thank you for making time to have this conversation with me on tonight. There's so much more that we could unpack. As a matter of fact, I'm going to invite you back to have some other conversation.
Okay.
I think that this is something that we need to do more often to make sure that people understand what's going on in the world in which we live. That we take a more proactive stance, with regard to our health, with regard to our intellect, with regard to our information seeking. And that includes within the church as well. I think that it's important to read the Bible and the newspaper. It's important to make sure that we worship and work out how we gather information and how we live life between Sundays. So I thank you so much for that. So will you please share your YouTube channel, how we can follow you on social media? Please share that information.
Absolutely. So I'm on Twitter as well. So you can follow me on Twitter at Dr. Al Smith 2. Dr. Al Smith 2 is my Twitter. I share a bunch of information, my videos there as well, but I also share, again, factual information about the data that's coming out. I put my spin on that data that's coming out as well. So that's a great opportunity to connect. On YouTube as well, if you search for Dr. Alvin Smith on that, and there's some other ones in there as well, but certainly I should be one of the ones that pop up in that, and so please feel free to chime in. I'll share my link with you as well, Pastor. Just so you can share that amongst your congregants as well. But I routinely put stuff up there. I address this and a lot of other topics that we didn't get a chance to talk about with regard to medications that are being in clinical trials right now, like hydroxychloroquine and others. There's this concept now of reinfection or reactivation of viruses, which I also talk about. So there's lots of different things. I'd love to come back and have continued conversations with you. Thank you for giving me this opportunity to chat and have this conversation. I think this is very important, and presenting this to your congregants and the community at large. We don't have enough of us really kind of having these structured conversations. We see things from celebrities and what have you, but again, arming ourselves with knowledge from again, trained scientists and medical professionals as well. That's really what we need to do. One more thing, I also have a cadre of colleagues as well. Medical physicians, other researchers as well, that I'm more than happy to invite to this conversation as we go forward. I think that's absolutely important. I can address so many things, but again, it would be very helpful coming from a lot of different avenues and getting different perspectives as well. So I welcome the opportunity to have that conversation too.
And we will. So if you're watching right now, we will come back with more conversations that we need to wrestle with. And so thank you so much for that. And again, I want to thank all those from the Life Church who watched tonight, those who just watched on Facebook Live, from my page, from Alvin's page, from the church page. Thank you so much. And those of you who were in the comments, I know I thank you so much for commenting. I want to say this with you before we close out. If you have any question about whether or not COVID-19 is real, let me say this from a very personal standpoint. It's real. I never would have imagined in a million years that I would have lost my dad to COVID-19, and to watch the impact that it has on a person's physicality is devastating. And so I want to encourage people, don't play with this. Do not, I know we're in a culture now of privilege, and and we're used to having our conveniences, and we're used to having things the way we want them to. But let me tell you, social distancing is worth it. Not having church right now, it's worth it. It's okay having virtual worship right now, because if it saves a life, if it saves someone the heartbreak of having to watch a loved one suffer, if it saves someone from having to fight through, and then again, there are those who survive. Yes, there are those who survive, and we thank God for that. But again, we should in this season walk in faith, but also walk in wisdom. The Bible tells us that God has not given us a spirit of fear, and that's true. Fear isn't from God, but fear is real. And when fear shows up, our response to fear should be to walk in power, walk in love, but also walk in a sound mind, which means that our wisdom, our intellectuality, our love from God should inform us to know I have enough love for my neighbor to stay home and recognize I don't want to impact or harm somebody inadvertently. The power I walk in says that I walk in the power of a God that will enable me to do the right thing and to make sure that somebody else isn't impacted. But also, I have a sound mind, which means I have the wisdom, the intellect, the scientific knowledge, the blessing of doctors and those who are working on this, and I need to respond to that the right way. And when I do that, I help save lives. So I thank all of you. And right now, before we close out, I want to pause and pray for families who are impacted by COVID-19. I want to pause and pray for the nurses and for the doctors and Uber drivers and Lyft drivers and Walmart workers and grocery store workers. I mean, people who are having to work in the midst of a pandemic and who are putting their lives on the line to make sure we got food to eat and toilet tissue and resources. So I want to pause and pray, for all these families who've lost loved ones. And I pray for my family as well, my mother, my uncles and my cousins. I want to pray for all of us, because I want to make sure that we know that someone cares, that there's a God who loves you, and we love you too. And so we're going to pray right now and watch God have his way. And I look forward to having you back, bro. Again, my Alpha brother, again, HBCU grad, Diga Alpha Beta. Thank you so much, my brother. I appreciate you. Let's pray, and then we'll see y'all again on the other side. Let's pray, family.
Okay.
Lord God, we thank you. God, you are an amazing God. And God, we thank you, Lord God, for the gift of information, for the gift of science, for the gift of doctors, and the gift of researchers, and the gift of medical physicians, God. And we thank you, Lord God, for how you have informed us, God, through what you have provided. We also pray now, God, for you to bless and to protect those who are working in the midst of a pandemic. Every nurse, every doctor, every ER physician, God, every Uber driver, Lyft driver, police officer, mail person, God, persons who are working in stores, God, everyone, God, and if there's someone I miss, God, Lord, them as well. We pray now, God, for their safety, for their health, God, for their protection. God, we also pray now, God, for those who are impacted right now, who are fighting this disease. We pray now, God, for healing. Pray now, God, for strength, God, for fortitude. Pray, God, for a fight to fight through what they're in. We also pray now, God, for families, God, who have been impacted, God, who have lost loved ones. We We pray now, God, for families, God, for spouses, God, for siblings, God, who are having to grieve and bereave right now, God, the loss of someone who they love so much. But God, we thank you, Lord God, that you are a God who will give peace that surpasses all understanding. That you are a God that will provide love and care, God. And Lord God, we pray now, God, that you, God, will even, God, help those who are living now in isolation, God, who are at home by themselves, God, who are at home, God, having to wrestle with aloneness, God, and who are, and even, God, those of us who are having to wrestle through the new normal. Lord, we pray now, God, for you, to have, God, to help us all, but also, God, to help us, God, love our neighbors as ourselves. Lord God, we thank you so much. We praise you, God, for you being a great God. And Lord God, have your way. We love you, we trust you, and we thank you. In Jesus' name we do pray. Amen.
Amen.
All right. Thanks so much, my brother. I'll talk
Well,
to you
thank
soon.
you.
Hey, y'all, we are going to be back. So look for us, and we'll see you soon. Much love.
All
Peace.
right. Thank you. All right.